Thank you to Cures Within Reach and the reviewers for the opportunity to present our work on repurposing the antiviral valganciclovir to treat congenital cytomegalovirus-induced hearing loss. Congenital cytomegalovirus, or CCMV, is a primary infectious cause of sensorineural hearing loss, which is in turn responsible for substantial speech and language impairments in children. To date, there are no approved therapies for treating CCMV, leaving clinicians to use antivirals such as valganciclovir off-label. While there is evidence supporting the utility of valganciclovir for this application, its use is hindered by extensive interpatient variability in the relationship between dose and response, and the narrow range in therapeutic exposures that are both safe and effective. You can think of this as an individual's preference for putting salt on a steak. In one case, when not enough is added, the steak is bland. For valganciclovir, if not adequately dosed, it is ineffective. As exemplified by patient 1, who received a standard dose of valganciclovir, but progressed to deafness, had substantial impairments in their speech and language development, and eventually required a cochlear implant. When too much salt is added, even though the steak might taste okay, the diner risks skyrocketing blood pressure. When a child is exposed to too much valganciclovir, the drug yields stable hearing outcomes, but it increases the risk of adverse effects of the drug, such as neutropenia, as exemplified by patient 3. When the steak is salted just right, the steak is delicious without the added risk of hypertension. This is like patient 2, who underwent drug monitoring studies to individually tailor her valganciclovir dose, resulting in safe and effective therapy, stable hearing outcomes, and normal speech, language, and social development. Identifying the appropriate dose of valganciclovir is necessary to successfully repurpose valganciclovir for use in CCMV-induced hearing loss. CCMV occurs in approximately 20,000 infants annually, a prevalence of about 0.5% in the US. Of these children, over 20% will progress to hearing loss. 7,000 will exhibit some form of impairment or disability related to the infection, and approximately 400 will die. The unfortunate truth is that these sequelae will persist as the child ages, decreasing their ability to communicate and socialize with their peers, and diminishing their quality of life over the entire lifespan. Not only does CCMV significantly impact the child's well-being, it places significant financial strain on the patient's family and the healthcare system as a whole. CCMV and the associated disabilities cost the US healthcare system approximately $4 billion annually, more than the GDP of many small countries. At the individual level, the cost of immediate postnatal care for a CCMV-infected newborn costs about 4-fold more than uninfected newborns. While over the course of a child's lifetime, CCMV is estimated to cost $1.3 million. This is in stark contrast to the average retail cost of 6 months of valganciclovir of just under $3,500, which is potentially even cheaper when purchased through insurance or with medication coupons. Thus, effective valganciclovir therapy, for example in the case of patient 2, can yield a nearly 400-fold savings over the life of the patient. This project really resulted from the numerous examples I've had in my career of the critical role that drug exposure plays in linking dose and response. From graduate work that used drug exposures to show a drug's utility in preventing HIV, to finding patient-specific factors defining the necessary dose of immunosuppressants following heart transplant in children, to the stories of the 3 CCMV-infected infants I shared earlier, whose outcomes really turned on the use of drug monitoring to achieve the appropriate valganciclovir dose. My research has focused on using pharmacology to improve patient outcomes. Specifically, my experiences speak to the need to understand the complex relationships between dose, exposure, and response, which are even more complex in children and for drugs that exhibit narrow therapeutic windows, such as valganciclovir. Defining this relationship for valganciclovir will allow us to repurpose the current off-label use of the drug into something that is evidence-based and tailored to the individual child, which we anticipate will greatly increase the efficacy and safety of the drug. This $50,000 CureAccelerator grant will enable the analysis of dried blood spots collected from Valier to determine drug concentrations and viral titers using well-established and validated methods. While VALIR received substantial NIH funding, those funds did not cover these analyses, which were requested by the FDA as part of the IND process. These data are really critical to defining the dose exposure response relationship that we will use to individually tailor valganciclovir therapy, which we expect to benefit patient care sometime in mid-2023. I am fortunate to be joined in this research project by two internationally renowned experts in cytomegalovirus infection, Dr. Albert Park and Dr. Mark Schleiss. Dr. Park has particular expertise in cytomegalovirus-induced pediatric hearing loss, while Dr. Schleiss specializes in clinical virology with over 100 CMV-related publications. My research focuses on pediatric personalized medicine, using pharmacologic tools to tailor dosing regimens to individual children. Combined, we make a unique, formidable, and complementary team for treating CCMV-induced hearing loss. In summary, being able to share more stories like patient 2, who maintained her hearing due to valganciclovir dosing that was optimized for her using drug monitoring, relies upon knowing the dose exposure response relationship in CCMV-infected children. Successfully repurposing valganciclovir to treat CCMV could yield an enormous 400-fold savings over the child's lifetime. Combining these results with the findings of the VALIR trial will have an immediate impact on the off-label use of valganciclovir to the great benefit of the patients. I think this project forms a perfect union between Cures Within Reach's mission to drive more treatments to more patients more quickly through the use of personalized medicine, which seeks to use the right dose in the right patient at the right time. Thank you.